Well, let's now turn to health matters. President Bola Tinubu has flagged off a presidential women's health transformation initiative called RenewHer to safeguard maternal health and women's well-being. He described the program as an answer to one of the nation's most critical prayers and a cornerstone of healthier Nigeria, rating it as a national priority. Speaking during the launch and awards of the presidential villa in Abuja, President Tinubu, represented by Vice President Kashim Shettima, emphasized that women's health is fundamental to Nigeria's development trajectory. He explained that the RenewHer initiative will introduce a presidential focal office on women's health, working closely with the Federal Ministry of Health, the Statewide Approach Coordination Office, the Ministry of Women Affairs, and the Governors' Spouses Forum. That's to ensure women's health priorities are embedded in every state, every local government, and every community across the nation.
A society that neglects the well-being of its women and girls cannot lay claim to building a functional nation. This truth applies as much within the intimate walls of the family as it does in the architecture of our national priorities. That is why I share in the spirit and mission of this gathering. This mission places women at the forefront, and this inspires our resolve to build on the programs already in place to address maternal needs. Out of this collective commitment emerges today's launch of RenewHer, a presidential women's health transformation initiative designed to serve as a national engine of collaboration among all stakeholders in a campaign for a healthier Nigeria.
Women's health in Nigeria at the moment is experiencing tremendous improvements owing to the sincere commitments of the government, both at the national and subnational levels, and the huge investments committed to strengthening primary healthcare services and maternal and reproductive health. While challenges driven by systemic cultural and socioeconomic factors abound, the less favorable statistics on women's health in Nigeria is on the decline,